I'm Andrew Clavenna from Dallas, Texas, here to demonstrate the GraftNet XL. This is a case standard MIS T-lift type case. Important when collecting bone dust that you use different suction lines so that we don't put soft tissue into the bone dust collector. So here we are, tube retractor, facet joint, cephalad, caudal, and I'm just going to clean off some of the soft tissue from this facet joint as we would standard in any case. Here's where simply having the multi-port allows us to switch over to the suction tubing to collect our bone graft. Obviously, a 3mm matchstick, two-fluted device is better, as studies have shown. Flute size does make a difference. Definitely don't want to use like a diamond bit burr, as our cell viability would be much less. Benefit of the GraftNet XL is that the mesh collector allows us to irrigate without worry that we're diluting our bone graft. Clean. Classically, all this bone would be thrown away and wasted, and allowing us to harvest this and use it for our fusion has shown that this bone has mesenchymal cells and osteogenic potential to facilitate our fusion during our T-lift. So I've removed most of the inferior articular process of L4 and now going through the superior articular process of L5. One of the advantages of the GraftNet XL is that it does have a 3-foot suction tubing attachment to get your hand away from the collection device, decreasing weight on your hand to minimally change how you normally operate, as well as allowing the scrub tech direct visualization of your collected bone graft so they can notify you if you're filling up the device. And it does allow for a large volume of collection. It also has a clip attached so that the scrub tech can clip it to the mayo or hang it from the mayo so that it's out of the way and you don't have to worry about it falling onto the floor and contaminating sterility. And using the drill to remove this bone, it allows us to get down to that cortical edge and overall minimize the use of the kerrison. Less kerrison use, less fatigue you have to worry about in your hands. It is important after you're done collecting your bone dust, your suction tubing attachment, especially if you're using the 3-foot adapter, has extra dust in it, and you'll want to collect that by simply irrigating through the suction device. As you can see, all that extra irrigation is suctioned out, and we've got our bone graft in the mesh bag. So after you're done harvesting your bone graft and you've irrigated your suction tubing, make sure and turn off your suction to decrease the vacuum on the container, and then simply counterclockwise turn of the lid allows the lid to be disengaged. This gives you access to the mesh bag in the center. Your bone graft still will be somewhat hydrated, so you can simply squeeze that mesh bag to get further liquid off of your bone graft. Once you're ready to get the bone graft out of the mesh bag, simply invert the mesh bag to expel your bone graft. You can put your fingers inside to tint up the mesh bag to allow you to scrape off any residual bone graft. There's a fair bit of bone graft here, and this is from just taking out a unilateral facet joint. GraftNet XL not only allows you to collect a large amount of bone graft, but the handling characteristics allow for moldability. Obviously, this then can be added to a substrate to increase your overall graft volume, such as PRP or Allisync DBN. So to illustrate how much bone graft you can get, again, this is just from a unilateral facet harvest. In a 5cc syringe, we are able to decrease overall costs and potentially less use of extenders